When you're planning for an early retirement, you can account for gas, you can account for rent, you can account for groceries. But the one X factor that seems to cause everybody problems is healthcare.
And it seems like a bottomless pit of rising costs and confusing rules, but it doesn't have to be. Whether you're early retired, traveling in the United States, or you're overseas with the world as your backyard, there are options for you to be covered in healthcare without breaking your bank. Away we go traveling.
So today we're going to talk about the healthcare puzzle, what you can do to solve it, and how you can use that to hopefully make your early retirement a little easier. All right, so this topic is the most commented and the most emailed question we get all the time. And it's complicated, which is, I think, why most people tend to avoid this topic. It's not easy to talk about healthcare. There's so many different options and ways you can do this. So it takes a lot of time and effort to put this in. So you guys have asked for it. Please watch all of this. Do us a favor.
We're doing this video for you.
This video is going to be focused primarily on those retiring out of the US. And when I say retiring, it really doesn't matter. It's anybody that's less than 65 who can't get on Medicare. So it's going to apply to you. If you're not from the US, then you just get to sit back and watch this video and laugh at all the things we have to deal with. You're welcome.
For early retirement in the United States, this is not about your wealth. It's about your tax return, because the healthcare marketplaces don't care about your independent wealth or what's in your bank account. What they care is what's on your tax return, as in your taxable income.
Right. And you got to remember too, we're not tax professionals.
Nope.
And we're not financial advisors.
Exactly.
So take all of this with what it is, which is just two people who have done some research trying to help you with healthcare. So in your individual situation, how much money you make, how much money you claim in your taxes, how much money you have in your accounts, those are all individual to you. And you're going to have to evaluate that stuff with your financial advisor or your tax preparer. We're trying to help you with your options, but this is not going to be advice for your particular situation. Again, this is a complicated topic and it's very niche depending on how old you are and where you live and your gender and whether you're married or not. So there's lots of things going on here. So just understand that. All right, first up, this is the big one and sort of the most known and maybe the easiest, I guess, to talk about. But it's the Affordable Care Act, or potentially Obamacare, whatever name you want to call it by. But it's the US's healthcare system for people who don't have it provided through work. It provides healthcare based on subsidies, and those subsidies are based on the federal poverty level. So if you are between 100% and 400% of the federal poverty level, there is a subsidy available for you. Depending on where you are in that range, between 100 and 400, your subsidy will be either significant or actually they're significant even at the 400% level. They're significant regardless, but they're a sliding scale. So as you get less income, you get more subsidies. So the ACA is really about how much your adjusted gross income, actually your modified adjusted gross income, which we'll put definitions of those on the screen, is for that year. You have to be above 100% because below 100%, you are technically going to be on Medicaid. So there are some states, they actually make it a little harder. You have to be 138% above the federal poverty level. So rule of thumb, between 100% and 400% of the federal poverty level, and you're going to get some sort of ACA subsidy. That's option one.
So one of the other alternatives in the United States for healthcare is a system called Healthshare. These are groups, they're nonprofit organizations it's not actual insurance, know that. But it is a group of people who do cost sharing, and it's a group that's based on a common interest, such as potentially a religious affiliation or something like that. Again, that's called a health share.
Yeah, we'll talk about those more in detail. Another potential option in the US, and again, if this applies to you, you probably already know, but if you're with a company that had a pension and that pension came with healthcare, or you're retired military, or you're retired federal or state government, a lot of times those will have healthcare associated with them. But again, if you have those, you probably already know. We'll touch on those, sort of the details of those a little bit later, but that's another option if you're staying in the US as well. So, essentially we're looking at ACA or these health share programs, which we'll talk. The next potential option is if you're willing to leave the United States, and again, I think this is becoming more and more common. Certainly people of our generation, the Gen X generation, or the elder millennials, or the younger boomers, that are not tied to a traditional retirement, if you're willing to move overseas, the cost of overseas healthcare can be fractions of what it is in the US. And there's a number of options that we'll talk about that are potentially there for you if you're willing to relocate.
The last option is a self-funded type of style. This is more of a catastrophic healthcare plan. Think of it like your car insurance, that you don't call or put a claim in your car insurance if you need an oil change. So small things like checkups or maybe a dental cleaning, you just pay out of pocket. And you have an insurance policy that covers catastrophic issues.
Kind of the YOLO plan. Not sure I'd recommend it, but this is certainly an option for you. This is probably only going to be people who are in really good health and don't mind taking a little bit of a risk, but it's there for you.
Yep.
Okay, now we're going to talk about the ACA in very specific terms. And this is going to be a real life example that I did from the ACA website. So there's going to be actual numbers involved, but as a rule of thumb, if you're a single person retiring before the age of 65, you can expect to pay somewhere between $500 and $1,000 a month for your ACA. For a married couple, you're looking somewhere between $1,000 and $2,000. That's without a subsidy. So that's going to be the full cost. And we'll talk about where the subsidies kick in. It goes back to that, where you fit in the federal poverty line between 100 and 400%. So we'll get into some actual numbers. Just understand, when I did these examples, this is a couple. So this is a married couple and a single person who are 55 years of age. Again, it's older than us, but it's sort of in the middle of where this would be considered maybe an early retiree if you're going to retire at 60 or 53. It's going to be a little bit different on the numbers, but it's a 55-year-old, both man and woman at 55, and retiring in Florida, because that's where we are. It's where we came from. So I used Florida. Again, the states are going to change as well. And I picked the silver plan for the ACA, which is the mid-grade plan. And I picked medium with regards to how much you're going to use the doctor. So it was regular doctor visits, regular prescription visits, and no expected hospital visits. Doesn't mean they're not covered. They just weren't expected. So I kind of did medium on this. So these numbers are going to be right in the middle of this whole thing, just so you understand what I'm talking about. For the first one, let's talk about single people who are retiring, looking for an ACA. If your modified adjusted gross income is above $63,840 for 2026, and that is a hard line now. If you are $1 above that, you lose all subsidies. If you are $1 underneath it, you get your subsidies. So you got to be really careful about how you do your income. And we'll talk about some strategies here in a little bit. As a single person with that modified adjusted income, you're looking at paying around $1,200 a month with that silver plan as a 55-year-old in Florida. And the way the website does it, they actually estimate how much you're going to pay with regards to your copays and the cost sharing, all the pieces around it. They estimated for that person, it would be about $16,000 a year for your overall costs. Okay, so that's what it was for your adjusted gross income being above the line. You're above the hard cap. For a couple, same situation, silver plan, medium use, 55 years old in Florida. That plan went from the $1,200 to $2,300. Not quite double, but it's in that ballpark. And they estimated, again, $32,000 yearly. These are hefty numbers. Those are not something that most people, if you're trying to early retire, unless you're retiring with millions of dollars, that's really going to work for you. And I don't think most of us are in that situation. So we want to try to avoid this one. We don't want to be below that line. We don't want to be above that hard cut line. Let's talk about the under the line. And I only did this in one scenario. I went $1 below the line, which is actually going to be the worst of the subsidies. If the more you drop down, the more you can, more income you can reduce, you'll actually have more of a subsidy. But in this case, if that same person who retires as a single on a silver plan, medium use, Florida, 55 years old, they would pay $527 a month instead of $1,200, with an estimated yearly of $8,100. So basically, it cut it in half by moving under $1 underneath the cap. And I think if you're careful, you can really make sure that you stay under that fairly easily. As a couple, same thing. Before they were $2,300. Now it would drop to $719 a month with an estimated overall cost of $12,500. Again, significant savings for getting underneath that that hard cut of the modified adjusted gross income. And for the married couple, the cut for this year is $86,560. Again, be a dollar under or a dollar over, you lose it, okay? As mentioned before, these are a sliding scale. So I played with the numbers a little bit, just as a for example, if you went, instead of as a single person, having that 63,000 and change, if you dropped it down to 50,000, it actually went down to $420 a month and an estimated overall of $6,900 a year. And if you could do the same thing as a couple, now obviously it's gonna be a little harder as a couple, but if you could do it the same thing as a couple, it went down to $350 a month and $8,200 a year. So just understand that these numbers are very nominal. I picked the cheapest of the silver plans. When I went through this process, there were hundreds of plans to pick from. There's catastrophic, there's bronze, there's silver, there's gold, and there's platinum. Each one covers different things at different deductible levels. It covers, different situations. So you have to pick those based on your particular situation, your current health status, any of the conditions that you currently have, medications you have. That's why this is really hard to talk about. I'm giving you the right down the middle, medium, middle-aged, type person to give you an idea of where this is. The key point to this is there are significant subsidies available to you if you keep your modified adjusted gross income below those hard caps. Additionally, if you can actually make your modified adjusted gross income 250% or lower of the federal poverty line, most of the premiums that I was playing with in the bronze and silver plans for sure all went to zero. There actually wasn't a monthly premium. So if you can show, your modified adjusted gross income 250% or below the federal poverty line, you won't be paying anything for these ACA plans. So there's ways to manipulate this. Just understand, the ACA can be very expensive, but if you're living on a small amount of money and maybe you own your own home already or your cars are paid off and you're not paying a lot monthly and you don't need a lot to pull out a lot of your accounts, this could work for you.
All right, so let's talk details. Again, let's reiterate that when you're retired, the IRS doesn't look at your bank account or your wealth. What they care about is your tax return and what is your taxable income. Mm-hmm. That is honestly the secret to getting some of these premiums, like a silver plan through the ACA, for about the price of maybe your cell phone bill.
All right, the first strategy that you can use for this is if you need, let's say you want to live off of $100,000 a year. Again, it's just sort of a round number. It doesn't matter. That's obviously above your adjusted gross income that's going to get you any sort of subsidies. So what you can do is rather than pulling all of that money from taxable accounts or places that are going to trigger an adjusted gross income, you can actually pull from your Roth IRAs. Any money you put in, even before 59, you can take out if it's the money you put in. You can't take the gains out, but the money that you put in, you can take out tax-free. Same thing applies to cash. So the first place you can take money from if you need to adjust your subsidies and try to adjust what you're living off of and keep your adjusted gross income is to pull from your Roth IRA that you've put in and any cash that you have in some sort of brokerage account or savings account, however you want to do that. All right, the second one up is in your taxable brokerage account. Let's say you own stocks, mutual funds, index funds, doesn't really matter. But inside your taxable brokerage account, anything that you have put in there and you've bought, when you go to sell those shares, you only pay taxes on the gains for those. So if you bought $10,000 worth of stock and then it earns $2,000 and you need to take that $12,000 out to live this year, you're only going to pay taxes on that $2,000. So that 10 you initially put in doesn't count against this cap. So that's another potential avenue that you can use to fund an early retirement, yet keeping your adjusted gross income below that hard cap. Okay, lastly, this is a little odd, but it's kind of cool, something we learned in doing the research for this. At the very least, and I don't know if it applies to the silver plans, but I know in the case of most of the bronze plans from the ACA, they are HSA compatible. So any money you put into your health savings account, your HSA, actually lowers the amount of money that your adjusted gross income was at. So let's say your adjusted gross income was at, $87,000. You need to get below that hard cap. You can actually put in $2,000 to your health savings account, get yourself below that hard cap, and save yourself thousands of dollars a year by putting that money in a health savings account, which you can then use to fund your healthcare next year, this year, whatever it is. You can use your health savings account to fund your health expenses. So that's one of those deductions that you are just sort of putting that money aside for healthcare, but it lowers your adjusted gross income today. For an individual, I think the current HSA limit is $4,400 a year. For a couple, you're looking at $8,750. So if you as an individual retiree are trying to stay below that 63 and change cap, and you as a married couple are trying to stay below that 86 and change cap, you can donate to your HSAs, get that number below the hard cap, and then you have that money put aside for healthcare costs later on in your retirement. If you're 55 and older, you can actually add $1,000 to both of those things. So in this case, where I'm taking this 55-year-old couple, you're looking at $5,400 or $9,750 for your HSAs. So it'll take some work to do this. This is not going to be an automatic. You're going to have to not just spend money out of your retirement account. You're going to have to categorize it, and you're going to have to spend it in the correct order from the correct accounts to ensure that you stay below those hard caps. This is where potentially either having a financial advisor, if you have one, will really assist, or if you're doing your own financial advising, kind of like we are, staying up to date on all these numbers and where your provisions are, where you can lower your adjusted gross income, and keeping really good tabs on the amount of money that you have coming in from dividends or from potentially pensions you have, whatever it is that's building up your adjusted gross income, keeping good tabs on that so you know what you can take out and from what account.
Let's talk the second option that we mentioned before, which is Healthshares. Again, these are not actually insurance. They're not governed by insurance, federal or state laws. This is a group of people who are aligned either religiously or ethically, who pool their money to cover the costs of those who are also in their group. But just know, again, this is not insurance, so there's no guarantee of actual payment.
Right. But we do know people who have used them and used them successfully for years and years. So we've never personally used them, but we'll give you the information about them. So if you want to look into them, you certainly can. All right. So the first one we're going to talk about is Zion Healthshare. So this one is one that is for people who are ethically aligned. It's not a religious alignment for this health share. Again, just like the other ones, it is a health share. This is not insurance, but we do know people who have used things like this. For example, for Zion, for 2026, as a single person, you'll pay about $290 per month. Okay. Now, just like regular insurance, they've got different levels. They've got higher or low plans. I think this is kind of the medium plan. Again, trying to pick right down the middle. So $209 a month. That also has a $2,500, what they call initial unshareable amount, which means if you have some sort of health issue, you go to the hospital and they send you a bill for $12,000, you're going to pay the first $2,500 of that. And then they're going to pay the rest. It's going to be shared among the group, right? So if you get a $10,000 bill, you're going to be covering $2,500. They're going to cover $7,500. So it's not exactly catastrophic coverage, but it's in the ballpark of catastrophic coverage. They're better than a catastrophic coverage for sure, but there are some limits where you have to pay a little bit. Now, if you want that initial unshareable amount to be lower, you can pay a little more per month. I think it went from like $290 to maybe $400 a month or something, and then you paid less per incident, is what it is. So for a couple, again, this is a couple in their 50s. And I think these were much less narrow ages. So I think these were like, if you were between the ages of 50 and 64, the kind of that early retiree time frame were these prices. But if you're a couple, you're looking at about $490 a month. Again, with that same $2,500 initially unshareable amount. And then after that, the health share kicks in and they pay for the rest of that. So the nice thing about these plans, there's no network involved. So you can go to any doctor or any hospital, wherever you are, they'll travel with you. So that's great. They don't work overseas, but they're a good option for the United States.
So the next category within health shares are the religiously affiliated health shares. So these do have a set of requirements for this health sharing, again, non-insurance. They require their members to be Christian, attend or be a member of a church, and have also behavioral or lifestyle requirements of no tobacco, limited alcohol, and a few other things specifically based on the one you look into.
Right. It's not just you want to do this. And these are, again, they're religiously and ethically aligned. In this case, you have to be religiously aligned with what they're doing. If you're not, just skip right past these as options. All right. So the first one we'll talk about, there's several of these, but we'll talk about just a couple of them as an example. You can Google these if you want all of the different options and what they cost in every possible scenario. All right, the first one we're gonna talk about is the Christian Healthcare Ministry. It's one of the older ones. Again, when I was doing my research on this, it came up repeatedly. So as a, for example, if you are again, single person in your 50s in that area, you're gonna pay about $300 a month. They have an add-on that you can add on for $42 a month, which is a catastrophic cap. So anything above 125,000, they'll cover. So you have options in there. You have a little bit of, whether you don't think you're going to get the type of coverage, you don't have to get it. As a married couple, you're going to have prices right around $600 a month. They have that same catastrophic coverage. Again, it's $42 a month times 2, so it's $84 a month. And then that will cover any of those big hospital expenses that would cover, anything over $125,000. Again, these are examples, and no network. This is a really popular plan for people who don't mind dealing with the hospital directly, maybe negotiating their bills down. There's some work in here you may have to do, or negotiating the cash price on these things, because obviously the lower that you have to worry about paying, the less that you're going to have to pay out, and then subsequently the health share has to pay.
All right, so the next example we have in the health share category is called MediShare. This behaves a little bit more like actual insurance, with a PPO in network style situation where the providers actually do bill the network for this. It's just still a health share.
Right. So like most of the other ones, you're paying the bill directly to your provider. This one actually has, an actual PPO that's set up so that the billing goes through them. Same concept though, and again, it has the same type of requirements. I think this one actually has some discounts though too. If you meet certain BMI or health standards, they actually lower your monthly premiums. And again, I don't know in your individual situation where that would fall, but if you're in really good shape and you're healthy, I think this could end up being a cheaper option. For this one, for a single person, you're looking right around $270 a month for this. And again, it's kind of in the range of the other ones. And that one comes with, again, like all these, they have different plans. This is the middle plan, a $9,000 annual household portion. So that's sort of your cap as to what you're going to be paying on a yearly basis. Just like other insurances have a catastrophic cap, this one has the same thing. $9,000 is all you're going to have to pay on this thing at $270 a month, again, as a single person. For a married couple in your 50s, you're looking at about $560 a month, with that same $9,000 yearly cap, I guess, on what you're going to end up paying. So in all of these cases, in the health shares and the ACA, just like regular insurance, you're going to have an amount of money that, in addition to your monthly premiums, that if you're going to the doctor, if you're using services, you're going to be paying more. The less you use it, the less you have to pay. The more you use it, the more you're going to have to pay. So all of these things have pros and cons. But in these cases, there's nothing you have to do with regards to income requirements. If your income is significant and your values align with these might be great options for you. Okay, so the last option in the US, as we talked about earlier, if you have a job that had a pension, if you were retired military, if you were retired federal government, state government, doesn't really matter, and it came with some sort of healthcare, that's also your option. And those are going to be very inexpensive. If you're lucky enough to have those, great. But you already know that. So I'm not going to go into all of those. You know what you have. Good job.
And thank you for your service. So when you're moving or traveling overseas, this is a whole nother category, and it's a lot more affordable based on, the difference between the prices of US healthcare versus healthcare in the entire rest of the planet. So this can be a great option if you're traveling or living overseas, not in the United States. So these are just a couple of examples. There are a lot of options here. So starting with one of the biggest ones that's really common among international travelers or US expats is SafetyWing. This is really best for catastrophic coverage and is very limited to your time back in the United States.
I think it's like 15 days to up to I think it's 15 days for every 90. Okay, just like before, we'll give you quick numbers on these. And again, this is all available at their website. But if you're a single person in your 50s trying to do this, and these will adjust with age, obviously, but you're looking at about $170 a month. Again, that covers your overseas healthcare and then that small amount of time, that basically 2 weeks out of every 3 months here back in the US. If you're a couple, you're looking more in the area of $340 a month. So again, it just kind of doubles. Same time frame requirements. And if you don't want coverage for the US, if you're going to travel overseas and you're comfortable not coming back to the US or just completely self-funding your US healthcare while you're here on the option, chance you have something happen. You can get little cheaper plans. I think it's like $110 a month for the single and maybe $220 a month for the couple. And there's no US coverage at all in those plans. So there are inexpensive ways to do that. Again, these are very popular inside of the travel community for this category of insurance.
So the next example inside of the global travel category is Cigna Global. So this is really expat health insurance. It can cover a little bit more. It can also be a little bit more expensive. It's just a little bit more of a comprehensive plan, as an example.
Right. It tends to be a little more expensive too. As a single person, you're looking somewhere in the $250 to $350 range if you're going to be covering Cigna Global. And then in the couple range, you're looking more $500 to $700. Now, Cigna Global is interesting in that they will cover you fully in the US. The problem with that is that if you do that, now you're looking more like what the ACA plans will actually cost you. So you might be in the range of $1,000 for a single person and maybe upwards of $2,000 as a married couple. So at that point, you got to weigh do I want to be on an ACA plan or do I just want to get Cigna Global and cover myself worldwide? So you get a little more out of the Cigna Global because now you're covered worldwide, but it's also still very expensive. So there's pros and cons to this, but at least it gives you the option.
So the final option in global healthcare options for US citizens, anything outside of the United States, is to self-fund. So I'm sure you've probably heard of the term medical tourism. There's a lot of people that go to other countries where their medical care is potentially equivalent or close to what you would find in the United States anyway, and it's considerably less expensive. People go to Mexico, Turkey, all these places, and you could get for maybe a fraction of what you would pay out of pocket in the United States, even with the plane ticket, go over and get some care done somewhere else. You also have the option of some countries will allow you, depending on your residency requirements, visa requirements, things like that, to buy into their local government healthcare. So look into that. There are several countries that do it. You can do the research. And if that's something that appeals to you, maybe that's part of your plan.
Right. So for us, we actually use military healthcare. I'm lucky enough to have that from being retired military, although I have priced out the ACA extensively. I'm aware of what it would cost us in our situation based on our ages. And I do try to manage our adjusted gross income based on that because nothing's ever guaranteed. You never know when programs are going to get cut or prices are going to increase. So I like to keep all those in mind. So for us, for the amount of time we have between now and 65, we will likely have a blend of these over our time frame. We will definitely touch a number of these different options, and it'd probably be the same thing for you too, depending on what your scenario is.
So the healthcare puzzle is not a reason to put your life or your travel plans on hold. Whether staying in the United States and working your income and using the ACA or other options for healthcare, or you go overseas and decide to take advantage of the global healthcare options available to you, the whole point of this is for you to stay healthy and for your finances to support the early retirement lifestyle that you worked for.
Retirement is about having the time to do what you want. And you don't want to have to worry about doing a whole bunch of what ifs as you work down the road. So you want to have a good health plan in your back pocket. And we're trying to give you all these options so you can make these choices for yourself. Thanks for watching.
Happy traveling.
Kind of the YOLO. We don't recommend this, but it's possible.
Cool.
Yeah, it's fine.
All right.
Nobody gives a shit. Nobody's listening anyway. Do you want to redo that or is that all right?
Fine.
Okay.
By this point, it's not going to matter if I cut it up.
That's
Nobody's
true.
watching.
Who's watching anyway? Thanks for not watching.